Deputy Stephen Donnelly has question number 5.
Minister, this question is regarding healthcare, which I know your own department has become more involved in. And it's really an attempt to solve something that has been puzzling me for many years. We know that there have been very significant cuts in healthcare. We know that they have come at great pain to many people in the country. Ireland's healthcare spend per capita is about halfway up the OECD tables, but we've got one of the youngest populations. And there's research by the National Competitiveness Council that shows when you adjust for our young population, we have the second highest healthcare spend per capita in the OECD next to the US. But as we all know, we don't have the second highest healthcare outcomes. So in spite of all the pain that has been felt in trying to get on top of the healthcare budget, we are still spending more per capita when you adjust for the young population than anybody except the United States.
Thank you, Deputy.
And we're not getting the healthcare outcomes. There's plenty of outside-in analysis from the OECD and from others suggesting that a changed model of healthcare provision and healthcare expenditure, Minister, could actually save billions whilst improving the level of service delivery. And so my question is, have you commissioned an independent report that's gone into the wiring of the HSE to see if things could be done fundamentally different? Thank you.
Minister, number 4.
Yeah, I've not commissioned any independent analysis of potential savings in the health sector since March 2013. That would be a matter for the Minister for Health. I mean, we do have line departments with line ministers responsible for their own areas. In terms of analysis, the comprehensive review of expenditure was carried out during 2011 and was published in December of 2011 in conjunction with the 2012 budget. In my budget speech in October of last year, I announced a second comprehensive review of expenditure. The objective of this second review will be for each minister and each department to examine and propose measures that would contribute to the overall expenditure target set out by the government for each of the next 3 years. This review will also expand on the existing analysis carried out by departments and my department since 2011. The Department of Public Expenditure and Reform will coordinate the review process and will produce the final comprehensive report alongside the budget documents for next year. In addition, a separate review of capital expenditure is underway, which will set out the capital envelope for the next 5 years. In January, I published the government's second public service reform plan, 2014 to 2016. This sets out at a high level, the key priorities and objectives in the main public services, including health. As set out in the reform plan, there are very significant administrative reforms. There is usage of additional hours. There is areas of reform of overtime pay, premium pay, and all the rest. I should say to you, just in relation to health expenditure, because there is almost a given now that health expenditure has been greatly reduced. In the budgets introduced by this government since 2011, expenditure money given to the HSE has not fallen. There's a general commentary about expenditure cuts, but the facts are different. Net expenditure from 2011 to 2013, net expenditure for the HSE has increased by 72 million, not reduced. Total non-pay given to the HSE has increased by 407 million, not reduced.
Thank you, Mr.
I can give you the hospital details as well. So you're right, we need to drill down to make sure that we get value for the enormous effort we've made to maintain expenditure in the health area.
Deputy Donnelly.
Thanks for that, Minister. I'd love to get those numbers. The numbers we got from government show a fall from about 16 billion to a fall to about 13 billion for this year, but maybe I could get the numbers that you're looking at. The CRE, the Comprehensive Review of Expenditure, I've looked at, and first of all, it's an internal document, so it is the HSE trying to fix itself from a health expenditure perspective, which I don't think they do have the knowledge. I think what they've been asked to do and they've tried to do is incremental savings. So cut a bit here, cut a bit there, try and be a bit more efficient here and there. But I don't believe the HSE has the knowledge to look at the current healthcare system and say the way we deliver healthcare in Ireland, which is a hospital-based system rather than a community-based system, A, is not the best for the patient, and B, costs far more money than it needs to. So, Minister, I wonder, you said your own department hasn't commissioned any report. I wonder, do you know, and you might know because it's very relevant to public expenditure, whether or not an external report has been commissioned that looks at healthcare delivery in Ireland, looks at the HSE and says, actually, there is a shed load of money that can be saved by, for example, moving from acute to community-based care, whilst at the same time improving healthcare outcomes for the patient. I think it's a great opportunity. So can I ask you, Minister, do you know, even if your department hasn't, are you aware of any report of this kind? And if not, do you think there might be a great opportunity to commission one? Thank you.
Minister.
Well, I mean, most of these questions are more appropriate to the Minister for Health, because there is an enormous reform agenda underway. Because the structure that was put in place, building a superstructure of the HSE on top, basically, of the old health boards, just hasn't worked. It has been an extraordinary top-heavy. And to disentangle that is a huge body of work. Now, if you ask me my personal view, I think there is an enormous amount of focus on structural change, and you're suggesting more structural change, where I think we need to actually do what we're doing particularly well. We're moving from acute to more focus on primary care. We're providing the resources for that. But I'll give you specific figures. I might actually write them to you rather than expect you to take them down now. But, you know, for clarity, total HSE expenditure fell by 19 million euros between 2011 and 2013. It was, in 2011, 13.903 billion, and it's now, at the end of 2013, 13.884 billion.
Thank you. I'll come back to the Minister. Deputy Donnelly.
Thank you, Askin Corley. Thank you, Minister. Here's the opportunity as I see it, having worked in healthcare abroad. I've said to some of the most senior people in the HSE, show me the plan, show me the document that says, look, this is how healthcare delivery should be in terms of primary care centres, community-based teams, home care, respite, all that good stuff. This is what it should look like. Here's what it looks like today, which is an acute-based model, and here's how we're going to transition from the model we have today to the model that we need. And that document and that thinking hasn't been done. So yes, there are primary care centres opening, which is welcome, and yes, there are some valuable things being done. But I would put it to you that there is an enormous opportunity for the country, for someone to come along like yourself or in conjunction with the Minister for Health, because it is both a healthcare and expenditure issue, and say we don't have a whole Ireland strategic view. They did it in Northern Ireland about 3 or 4 years ago. They have a strategy that says this is what we want our healthcare system to look like, and here's how we're going to get there. We don't have one of those. And could I put it to you, finally, that maybe you would consult with the Minister for Health, because it is, I believe it is across both of your departments, to say, should we be bringing experts in, and should we be putting that sort of strategic thinking and planning together? Thank you.
Minister.
All these questions are appropriate for the Minister for Health, not for me, I obviously have to mind the money and make sure that we get value for money. But specific policy issues in relation to the Department of Health come to government from the Minister for Health. But we do have a cabinet subcommittee on health, and these things are trashed out very clearly there. There is a strategic view. There is a strategic plan. We are moving from over-dependence on an acute hospital provision to development of effective primary care provision. But all these things can be spelt out by the Minister for Health at a committee, probably the best way, where you have time to interact and bring officials from both the HSE and the Department of Health along for the discussion.